Hello everybody, you are watching Rat Technologies with Jit Ghosh, and today we are going to discuss about the most important topic of the CT examination, that is a coronary angiography. In this video we are going to discuss about what is the coronary angiography is all about, what is the CT coronary angiography is all about, and how the CT coronary angiography is different from the traditional cathedral angiography. We are going to discuss about when we will perform the cathedral angiography and when we will perform the CT coronary angiography. Okay, in this video we will also going to learn about what are the advantage of the traditional cathedral angiography as well as what are the advantages of the CT coronary angiography, as well as we will also going to know about what are the disadvantages of the CT coronary angiography as well as the disadvantage of cathedral coronary angiography. Okay, so also in this video we will going to discuss about how we will prepare the patient for the CT coronary angiography, what are the patient preparation we will do to perform the CT coronary angiography in the patient, what are the technique we will maintain and what are the technique we will apply to perform the CT coronary angiography, as well as we are going to discuss about what are the precautions we will take during performing the CT coronary angiography, and also we will going to learn about what are the aftercare we will maintain to examine the patient or after performing the examination to the patient. So there are lots of topics we are going to discuss about. We'll get a complete exposure about the CT coronary angiography as well as the traditional coronary angiography. So to know each and everything, watch this video without skipping, and if you like this video then do subscribe my channel for the unique topics video in a forensic radiology and other topics of radiography and imaging, CT, MRI, that will make you more knowledgeable. Okay, so first of all I will discuss about the traditional coronary angiography, then I will come to the advanced and the modern CT coronary angiography. Okay, so traditional coronary angiography is basically one kind of procedure which is invasive in nature. Why we are saying it is invasive in nature? Because it basically deals with the introduction of a catheter into our body, and with the help of that catheter a contrast media is being injected into our body. As because there is an introduction of catheter is involved, it is invasive, which means that we know that the invasive procedure do have some risk factors. Okay, and what is angiography is all about, it is also important to know. Angiography is basically the examination of the artery with the help of a contrast media administration to delineate all the arteries of the heart that supplying the heart muscles. So in traditional coronary angiography, in cathedral angiography, what we are doing is that we basically administrate a radiological contrast media with the help of the catheter to delineate the arteries of the heart which are supplying the heart muscle, to detect any kind of heart blockage, and if we get any kind of heart blockage then we can also perform the treatment, or we can open or we can clear that blockage in the CT in a traditional coronary angiography, in the cathedral angiography. Now we are going to discuss about what is CT coronary angiography is all about. CT coronary angiography is basically a non-invasive or minimal invasive procedure to perform the imaging of the blood vessels of the heart with the help of the radiological contrast media. Okay, it do not deals with the administration of any kind of catheter, it only deals with the administration of a radiological contrast media through a cannula. Okay, as because there is no catheter is being introduced during performing the CT coronary angiography, so there is a less or zero or minimum or negligible risk associated to the patient against this procedure. So CT coronary angiography is more safer as compared to the traditional cathedral angiography. Okay, so now we are going to discuss about how we will know that which patient requires what kind of examination for detecting the heart blockage or coronary heart disease. Okay, so basically the answer is if the patient already is diagnosed with a heart blockage in the various examinations, like patients has been diagnosed heart blockage or myocardial infarction in the TMT, ECG and the echo, then in that condition it is a good step to perform the cathedral angiography in the cath lab of in the patient. Okay, so in that case we know that the patient is already having a blockage. So if we can perform the cathedral angiography in the cath lab, then if we can see the defect, then we can easily clear it. Okay, we can do a treatment it, okay, with the help of a balloon or with the help of a stent. But if the heart blockage is not confirmed and we want to know that whether the patient is having a heart blockage or not, in that condition patient can go for a CT coronary angiography. So CT coronary angiography is good examining tool to detect the blockage, detect the percentage of blockage, or to clear our query that whether the patient is having a blockage or not. But it is not a good option for the treatment. Okay, so CT coronary angiography with the help of the calcium scoring and with the help of the 3D images that can be post reconstructed using a software, easily demonstrated if any blockage present in the heart, where the cathedral angiography will demonstrate the blockage, as well as with the help of the cathedral angiography we can also clear that blockage with the help of the balloon or stent. So this is the main difference. So now we are going to discuss about what are the advantages and what are the disadvantages of both the traditional cathedral angiography, as well as what are the advantages and disadvantages of the CT coronary angiography. And what are the similarities, we are also going to discuss about it. So what is similarities between these two is that both the imaging technique using a use or applications of radiation. Okay, so in coronary, in cathedral angiography, in cathedral coronary angiography, what we are using a CR machine, and CR machine uses X-ray radiation, and also in CT scan we are using a X-ray radiation. So the difference is that in CT scan the amount of radiation is little bit higher, so there is a chances of the radiation induced effect in the patient who is performing CT coronary angiography. But in cathedral angiography the radiation is not that much higher as compared to the radiation that is used in the CT scan, so it is little bit safer. Okay, second thing is that to perform the angiography, particularly coronary angiography, in cathedral angiography, in traditional cathedral angiography, the use of contrast media, the amount of contrast media is very less. Okay, but in CT coronary angiography, the amount of contrast media we administered into the patient body for performing the examination is higher as compared to the cathedral angiography. Generally, for performing the CT coronary angiography, we are using a contrast amount of about 80 to 150 ml according to the weight of the patient. But in cathedral angiography, in cathedral coronary angiography, generally 20 to 40 ml is enough. Okay, so this is the main disadvantages and advantages between these two. And as because in CT coronary angiography you are using a higher amount of contrast media, so there is a this increase the more chances of the contrast media induced effect in the patient's body. Okay, but as because in traditional cathedral angiography you are using a less amount of contrast media as compared to the CT scan, so it basically reduces the chances of the contrast media induced effect in the patient's body. So cathedral angiography, as on the aspect of the contrast media induced effect, the cathedral angiography is safer as compared to the CT coronary angiography. CT coronary angiography do some effect, contrast media induced effect, but this is negligible. There is a negligible effect is been noted as per the researchers, or as per the daily we are performing the examination. The negligible effect is been noted. This in rare cases it is happening, the contrast media induced effect. Also, the resolution of the images that are acquiring in the traditional cathedral angiography is higher as compared to the resolution of images that are acquiring in the CT coronary angiography. Okay, and the most advantages of the cathedral angiography is that we can treat after detecting the blockage, but in CT scan we can only detect, we cannot treat it. Okay, so these are main disadvantages and the advantages, and basically we have know that if the patient is already diagnosed with a heart blockage, we will go for the coronary cathedral angiography, and if the patient is not properly diagnosed with a heart blockage, then it is better to perform the CT scan. Okay, which is less invasive. Also, CT coronary angiography is less expensive as compared to the cathedral angiography. The cathedral angiography is little bit expensive as compared to the CT coronary angiography. The CT coronary angiography is basically a day care procedure. Means patient just come and we will prepare him and perform the examination. The patient can easily go to the home or into daily life work, daily activity. But for cathedral angiography, patient have to admit first. Then after admitting the patient, we will prepare the patient, and then we will take the patient to the cath lab, and after taking the patient to the cath lab, we will do the invasive procedure of cathedral angiography with the admission of catheter. Okay, so CT coronary angiography takes a less time, and it is having a less risk, and as well as cathedral angiography have some its advantages as well as some disadvantages. Okay, so we have already know what is cathedral angiography is all about, what is CT coronary angiography is all about. Now we are going to discuss about CT coronary angiography technique, patient preparation, after care, and what are the precautions we will take to perform this examination. Okay, so first we are going to discuss about how we will prepare the patient for the CT coronary angiography. Okay, so if the patient come to us for CT coronary angiography, then to prepare the patient, we will do the following things. First, we have to take the history of the patient. We will ask the patient whether the patient is having any kind of contrast reaction or not, patient is having any kind of allergy or not, patient is having allergy to any kinds of food or medications or not. We will going to ask the patient, patient is having any kind of surgery or not, patient is having other tests or not. If the patient have lots of tests, then we will instruct the patient to bring all the test report on the day of the examination. Also, if the patient say that yes, he is having a contrast media reaction previously, or patient is having allergic reaction, or patient is having any kind of allergy due to any kind of food or medication, then we will instruct the patient. We will prepare the patient by giving some steroid medications. We will give the patient methylprednisolone that the patient will take 32 hours and 12 hours prior to the examination to reduce the contrast media induced side effects or allergic anaphylactic reactions. Also, we will instruct the patient to hydrate properly. Also, we will instruct the patient to drink more and more water for 48 hours prior to the examination to reduce the contrast media induced effect. We will also ask the patient whether the patient is having any kind of kidney disease or not, whether the patient is having a chronic kidney disease or not, or chronic heart disease or not. We will going to ask the patient whether the patient take any kind of medications of heart, whether the patient is diabetic or not. If the patient is diabetic, then what kind of medication the patient is taking. As we know that the metformin have some side effects when it is being administered with the contrast media. So we will instruct the patient to discontinue the metformin medication at least for 48 hours prior to the examination or prior to the admission of contrast media. So this in this way you have to prepare the patient. Also, you have to note the heart rate of the patient. If the heart rate of the patient is basically higher than the 60 to 65 beat per minute, then you have to give the patient beta blockers to reduce the heartbeat, because we know that it is very important to maintain the heartbeat of the patient below 60 for good images to be acquired while performing the coronary angiography. Okay, so we will prepare the patient in that way, in this way. So this is basically a part of the primary preparation of the patient. And now we are going to discuss about the secondary preparation of the patient. So on the day of the examination, when the patient come to us after taking the primary preparation, so what we will do? How we will prepare the patient secondarily? So when the patient comes on the day of the examination, we will first, what we will do, we will place the patient in a supine position over the CT couch. Then we will explain the procedure to the patient. We will explain what are the risks and benefits associated with the CT coronary angiography. We will train the patient regarding the respiratory gating or respiratory triggering or the respiratory practice of the patient. We will explain the patient to take a deep breath and hold the breath. Do not instruct the patient to take a breath very deeply, because if the patient takes a breath very deeply, then the pressure will be created in its abdomen and patient will feel discomfort, and in that condition it is very hard for the patient to hold the breath. So instruct the patient to take a soft breath and hold the breath like this and hold it. So this is more comfortable for the patient, and that will make our examination more comfortable and helps to acquire more good resolution image without any artifacts. After explaining the procedure to the patient and practicing the patient regarding the respiratory breathing, we will shape the patient's chest for the attachments of the ECG leads. And after the ECG leads has been attached properly, cannulation will be done. A channel will be done in the patient antecubital vein, and after completing the channel, we will check our line, or check the channel is properly working or not, with the administration of a normal saline with the help of the auto injector. Okay, so also for extra precaution, before the administration of the contrast media, we can inject hydrocortisone injection, as well as an Avil injection, which is antihistamine medication, to reduce the contrast media induced late effects as well as allergic reactions. Also we will spray GTN spray in the sublingually, that will dilate the artery, helps in the calcium scoring detection and the bolus tracking process while examining the patient. So after doing all these things, just position the patient. A question generally arises whether we will put the patient's hand downward, or whether we will put the patient's hand upward. So question is that we can put the patient's arms downward and upward. Only important thing is that you have to make sure the ECG lead should not move. If the ECG lead will move, then there is artifacts will create in the ECG graph, and in that condition our examination will not proper. So generally in every place we will place the arms of the patient, extremity of the patient above the head, and we will always instruct the patient to hold this hand together in order to prevent the movement of the chest wall or the pectoralis muscle, because if the chest wall moves during the examination, then the image artifacts will be created that will create a bad impact on our images, that will create an not proper images or artifacts. Will destroy our image. Okay, so you have to do these things, and after that place the position the patient properly. Landmarks should be given, and after that you will do acquisition in the acquisition system. And after administration of contrast media, just ask the patient whether the patient is comfortable or not, patient is having any kind of complication or not, patient is feeling any kind of complication or not. If patient complains of any kind of sensation of heat in his body, or patient is complaining of any kind of metallic taste, feeling of metallic taste in the tongue, or patient is complaining of any kind of itching in their body or rashes, then you just have to assure the patient nothing is going to happen. This is the commonest thing that is happening to every patient who is been administered with the contrast media. After performing this examination, just ask the patient to wait in the observation area for observing, and you have to do observation of the patient for about 30 to 1 hour for any kind of contrast media reactions. Okay, so if the patient is having a contrast media reaction in that time, you can just give medication and save the life of the patient, or prevent the contrast media induced effect. Okay, so this is all about this topic. If you like this video, do like it, share with your friends and family, make them knowledgeable everybody, and subscribe this channel for more video like this.